There's no science without society, and there's no society without science.
I think that if anyone's able to link science and society, that's something that public health can really do.
Linking science and society means doing the very best science that we possibly can and making sure that the work that we do has real-world impact for communities here at home in New Haven and around the world.
Especially in math-related fields, I feel like sometimes the work can begin to feel a little bit abstract, but with the problems that we're solving, we're really trying to bridge that gap between what we do in the office and with our collaborators to what's happening actually in the world.
We are focusing on the public part of public health, of working with communities, meeting their needs, meeting them where they are.
The research we do here at YSPH is really focused on methodologically rigorous research that's going to build an evidence base to ultimately change population health on a local and global level.
When I think about linking science and society, I think about data-driven impact.
Science provides the data, the facts, the evidence, and public health is how we implement and use that data to support our society.
One of the many things that I do is bring in community members, bring in youth that are part of my research studies, bringing them into my research lab and training them as young citizen scientists.
How do we define science? In whose eyes do we define science? You know, I think in the work that I do with tribes, that's really important.
My work brings together my scientific experience and expertise, my lived experience, and my knowledge of communities that experience health disparities to understand how climate change, the energy system, housing all come together to influence human health. But then also, what are the policies and initiatives that can be leveraged to reduce greenhouse gases and also reduce health disparities.
The foundation of the work that our lab does on malaria vaccines is really built on the involvement of the communities and individuals that we work with in Senegal.
Bringing in the community members to actually be a part of the process of creating digital health solutions to improve health outcomes for their community is how I link science and society.